I'm Rebecca. And where I'm coming from today, I suppose, is as a fallible human being trying to find my way through transformation. I have a number of roles. I wear multiple hats. So my background is I'm a clinician, I'm a registered nurse, worked in community and acute hospitals. I've also served on hospital boards, voluntary sector boards, and also recently just completed a doctorate looking at risk and emotions in healthcare. So my practice and my views are shaped by a lot of theory and a lot of experience. And I think that's really important because when we often talk about work that we do, there's sort of claim of objectivity, I think, steps in. And I suppose my argument is that none of us are objective. We all bring our own biases and prejudices. And so here are some of mine about what are informing them. So when I was thinking about transforming, I've made some notes as well, just so that I can remember things. But when I was thinking about this idea of transforming, I'm very interested in words and what does the word mean. So the first thing I was thinking about, well, okay, let's look at the definition. And the idea of transformation is that there is a marked change in the form or appearance of something. And I think also implied in that transformation is always a good thing. And I suppose my first point is I might question that. I think when we're thinking about, is there transformation in the health service? And I think the health service and social care and public sector generally are often criticised as not being very innovative or transformative. One of the things that I do is I run a leadership programme for clinicians. And on the first workshop, we map out a timeline of the health service from when it started to the current day. And actually what you'll see is there are significant change happening all the time with quite major changes. And the health service of today is very different from the health service that I joined 30 years ago. So I suppose I'm rejecting this idea that transformation in health social care is a myth. But I do think that the word or the expectation of the word transformation can and has become problematic, as people have said. And I think it sets up this expectation. I shared with Shane that one of the jobs that I was given was to be a transformation director. And the first thing I negotiated was changing the title because I felt like I had to turn up at work each day dressed as Wonder Woman with my knickers on the outside of my tights and couldn't deliver. So I wanted to manage the expectations for myself and for others. But I think, does that therefore make it a trap? And I suppose I started to wonder, well, what do we mean by this idea of a trap? What is behind this need for transformation? Who decides things need to be transformed? And how transparent are we about that transformation? It made me think about different transformations that I've been involved in. And I think Shane referenced this idea that sometimes the claim for transformation is actually a euphemism for saving costs. And I think that people aren't silly and they recognise that. And so that becomes problematic if people feel that you're not being upfront with them. I think that also when we engage in that, then you start to notice about when our solution to a problem becomes the problem itself. And I think perhaps transformation might be something that we've got into, that we see transformation as a solution to our challenges in terms of some of the problems in healthcare. And actually that transformation is starting to become a problem, and some of the weariness that people were talking about may be kicking in. And I think if you're interested in that, there's a great book called Principles of Problem Formation and Problem Resolution, and it's written by Paul Václavic and John Weakland. So I would recommend that if you're interested. I think also the other thing is transformation implies that things need to change. And I think there is something that others have said about really understanding, well, what's going on and why. And I think it's important to do that from a plurality of perspectives. I think one of the things is a great quote that I like, which says that characterizing the problematic situation in certain ways can make one look for certain kinds of solutions, but often one's initial characterization might be misguided and inaccurate, and thus might be the main reason for keeping one stuck. And I think that often rings true. But I think, as people have said in the donut, there is this necessity or desire for hope. And I think that's quite interesting. So why do we want hope? What does hope do? I think hope has a purpose. It tries to protect us against despair and despondency. But but also perhaps at the same time it acts as a defence mechanism to facing reality of the situation, and we can find ourselves in positions of false hope, which perhaps don't help us either. During my doctoral research, I became really interested in this concept of alienation because I noticed myself feeling alienated, and I noted others around me feeling alienated too, and I was curious about that. And part of that was, I think, as the diagram at the beginning showed, about this disconnect between what people were publicly saying was needed and going on, and what people were privately saying about what was needed and what was going on. And so I think there's something about, for me, there's parallels in that in terms of what happens in healthcare, particularly with conversations with patients, often when they're facing difficult situations, and whether the professionals actually share what they're worried about going on versus what the patient knows is happening. And we do that often to protect people from their anxiety and to reassure them. And sometimes we do that as health professionals to protect ourselves from our own anxiety. So I'm wondering if part of the function of transformation is actually unconsciously, it's trying to protect us from facing difficult realities. And therefore, by doing that, we don't actually address what is going on. I think we often also observe this desire for positivity. And there's a fantastic book, again, I think, by someone called Byung-Chul Hun, called The Burnout Society. And he talks about the tyranny of positivity. And he describes a quote, which I think is quite interesting, is he just says, the violence of positivity does not deprive, it saturates. It does not exclude, it exhausts. And that is why it proves inaccessible to unmediated perception. And what he's saying is that because we have this pressure to be positive all the time, and actually we don't feel it, we're leading to this sense of burnout. And I think there's something about it's become really difficult to speak against because we get labelled as resistant to change or laggards, really derogatory language for people who are expressing concerns about what is going on. But at the same time, I feel very hopeful. I see great work happening where care is being transformed all the time. People are organising differently. I'm a member of a wonderful WhatsApp group called Flourishing, with predominantly a group of GPs, actually, who are radically transforming the way that they're running their practices and engaging with their communities in completely different ways. And I have the privilege as a trustee of the Queen's Nursing Institute to judge the awards. And some of the stuff that the nursing community teams are presenting in terms of what they're doing is just mind-blowing. But we were also asked about characteristics of change, what characterises and distinguishes it from change that works and change that doesn't. And that made me think about what do we mean about change that works? Works for whom? Who decides whether it's good change or not? And that the idea that everybody will agree on that. So we will have a variation around that. And I think that's really difficult. I think that, I don't know if anyone's ever seen the film I, Daniel Blake. But there's a fantastic scene in it where somebody comes to claim their benefits and they're late, and the bureaucratic process that kicks in that says that somebody can't be seen. And so there's the bureaucratic processes that we put in to try and make efficiency and productivity, and at the same time can detract from the sort of relational stuff about the work that we're in. We were also asked about I'm going through quite a lot because, as Rich said, we had 5 minutes to cover a massive load of stuff. But in terms of practice of change, we were asked about what are our favourite practical tools and techniques. So I'm a pragmatist. I think we need to be able to draw on a whole range of different approaches. I think that they have to be informed by theory, because I think we have an ethical responsibility to practice and be able to defend why we are saying what we're doing. We work in a system that deals with risk and emotional intensity, and actually transforming and changing the way that care is organised and delivered has an impact. And so as OD practitioners, we need to be mindful of that. I have some concerns around models. I think that whilst they're helpful, they can be problematic because they're often written in the abstract. They're written as sort of a general principle. And what I often observe is people get very fixated on trying to implement the model rather than focusing on what's actually really going on around here. But actually what I do find helpful are practices which I would call as human ones. So that's dialogue, being engaging in dialogue. And there's a fantastic book written by Patricia Shaw called Changing Conversations in Organisations. By using data, qualitative and quantitative data, stories and narratives. I'm a big fan of Schwartz rounds, where people start to hear the different experiences of what's going on, which transforms the way that people understand the situations and starts to respond differently. Co-production as well, making sure we've got a plurality of perspectives. I'm very conscious of time, Rich, and so sort of trying to close down. But I think one of the other things that we also ask is about politics and pressure of change. I think, we have to be realistic. We work in a political system. Politicians are working to constraints too, and they will have all sorts of pressures. But I think that it requires courage in order to do the work that we're doing. It requires ethics and morality, honesty about what's going on, to reject the textbooks that write the neat, abstracted, sort of post-rationalised view of change, and recognise it's messy and complex. It does take time. And we were asked, how do we value the practice of the progress of incremental change? Well, I think we need to value it as practitioners. We need to be brave enough to say, this is messy, this is complex, it will take time, and sit with the uncertainty and the anxiety that evokes from those around us.